There's a condition called neurogenic claudication that I think is worthy of some explanation. And maybe you've heard the term claudication thrown out, or even the term neurogenic claudication, but I wanted to take a moment to explain what that means. Claudication generally is referring to leg symptoms that come on with activity. Claudication with a vascular cause is an artery that goes to the leg, for example, is blocked off, and when a patient gets up and walks, they'll reach a certain threshold to where there's no longer good enough blood flow to satisfy the demands of the muscle, and they get pain in the leg and they have to stop. Neurogenic claudication can have some of the same symptoms, but is from a very different cause. Neurogenic claudication is due to spinal stenosis, or narrowing of the spinal canal in the lumbar spine. When the patient is standing, the spinal canal becomes more narrow because the ligamentum flavum buckles a little bit, and what was a 5 millimeter canal, already narrow, when the patient stands becomes a 3 millimeter canal, and after a certain period of time, the legs can no longer tolerate the symptoms because of the pressure on the nerves. One way to distinguish neurogenic claudication from vascular claudication is its presentation. A patient with vascular claudication would have a harder time riding a bike for a long period of time, whereas a patient with neurogenic claudication might only be able to stand for a minute, but could ride a bike indefinitely because they're leaning forward. Patients with neurogenic claudication find when they go to the grocery store, they have to lean forward on the grocery cart, and then they're okay. But as soon as they stand up straight, they start having leg symptoms. Neurogenic claudication is a surgical problem, and we can address it by doing a decompression of the spinal canal, which alleviates the pressure on the nerves and can dramatically improve a patient's walking and ability to stand. There's different types of surgeries that can be done for it, but I think it's worth an understanding of what it is and a recognition of it being a problem. And again, the differentiation between, is it a vascular problem, like a blood flow issue, or is it that we're having some kind of nerve issue with spinal stenosis?